Hi, today our group will be teaching you about respiratory syncytial virus, also known as RSV. My name is Mikayla and I will be talking about the etiology and reservoir of RSV. The scientific name for RSV is respiratory syncytial virus. RSV is a negative sense single-stranded RNA, and it is an enveloped virus with a helical nucleocapsid. Replication generally happens in the body's airways. The RSV viral gene expression and RNA replication goes on in the cytoplasm of the cell. Virions acquire the lipid envelope by budding through the plasmid membrane, and then move on to the damage and infect other cells. RSV produces syncytia, which are large multinucleated cells formed through the virus fusing membranes together of other cells. RSV originated in humans and was a major cause of serious pediatric respiratory tract diseases. This virus infects the respiratory tracts, particularly in infants, children, and older adults.
All right, so next we're going to talk about the transmission of RSV and how the virus is spread from one person to another. RSV is extremely contagious and it can enter the body through eyes, nose, or mouth. It's actually spread from the droplets that contain the virus. So these can be spread when a person who is infected with RSV, they cough or they sneeze. And if those droplets happen to get on another person, or if they touch them and then touch their eyes, nose, or mouth, they can also contract RSV. So the germs from RSV can actually live on hard surfaces for up to 6 to 8 hours. So that could include anything that they might touch, a crib, doorknob, countertop, anything like that. So say someone with RSV went and opened a door, and then 4 hours later you went to open that same door and you both touched the doorknob, and then you touch your eyes, you could get RSV as well. That virus can still be living there. It can live on soft surfaces for a shorter period of time. So those would include on the hands, on a tissue, anything like that. Contact that way can also cause the virus to be spread. And then also just any form of direct contact, like kissing a baby who had RSV. Really, any contact like that can spread the disease. So once you contract RSV, you're typically contagious for about 3 to 8 days. That's just on average. You can actually be contagious for up to 4 weeks. So you might be feeling completely better and no more symptoms, but you could still be contagious. So you need to be careful after you get RSV. And typically, this is actually most prevalent in the US from fall to spring. That's what they call RSV season. So summer, you can count your lucky stars and hope that you don't get RSV then. So the signs and symptoms of RSV can start as just a simple cold, but they tend to get a lot worse. So you might start with a runny nose, a cough, maybe a mild fever. But as it progresses, you can get a very high fever, a sore throat, major headaches, and the cough can actually lead to wheezing or difficulty breathing. This is especially scary in infants because they can get a bluish color to the skin, which comes from lack of oxygen because they aren't able to breathe well. And unusual lethargy. Typically, infants who have RSV will sleep for long periods of time. And these symptoms can typically appear about 4 to 6 days after you are exposed to the virus. Could be a little bit sooner, could be a little later. And for the most part, it takes about 2 weeks to recover from RSV. If you are dealing with an infant, possibly someone who has prior heart issues or anything that might make it a little bit more complicated, it could take longer. And if you are dealing with a very young infant, it can also be a life-threatening virus and something that you want to be very careful about. But for the most part, they are able to cure it pretty quickly in about 2 weeks. So those are the symptoms of RSV.
Hi, I'm Kaysie Larsen, and I will discuss treatment and prevention of RSV. Prevention is especially important in regards to high-risk individuals, such as premature babies, adults 65 and older, people suffering from chronic lung disease or heart problems, and people with weakened immune systems, such as those with HIV or who have undergone organ transplants or chemotherapy. Researchers are currently working to develop RSV vaccine, but there aren't any available. Though it isn't a vaccine, a drug called palivizumab is available to prevent severe RSV in certain infants and children who are at high risk for the disease. It can help prevent serious disease, but it cannot help cure or treat those already suffering from serious RSV, nor completely prevent infection. The palivizumab injection is in a class of medications called monoclonal antibodies. In other words, it is a genetically engineered antibody that mimics antibodies naturally produced in humans. It works by helping the immune system slow or stop the spread of the virus in the body. High-risk individuals can receive the injection in doses about every 30 days during RSV season. Once an individual receives an injection and the antibodies are inside the body, they bind with a protein located on the surface of RSV that allows the virus to fuse with host cells. This binding disables the fusion protein and prevents the virus from invading and infecting healthy respiratory cells. Studies show that the administration of this medication reduced the risk of hospitalization due to RSV infection about 50%. Important prevention measures that can be taken are to cover your coughs and sneezes with a tissue or your upper shirt sleeve, but not your hands. Wash your hands often with soap and water for 20 seconds. Avoid close contact, such as kissing, shaking hands, and sharing cups and eating utensils with others. Cleaning contaminated surfaces, such as doorknobs, and avoid touching your face with unwashed hands. A few at-home treatments to relieve symptoms include using over-the-counter medication to reduce fever, such as Tylenol. If there's an additional bacterial complication, such as a bacterial pneumonia, antibiotics should be used as recommended by a doctor, but not under other circumstances. The infected individual should also drink plenty of fluids. In cases of severe RSV illness, hospital care may be necessary, where a few other treatments can be administered to relieve symptoms. These include intravenous fluids for hydration and humidified oxygen. Mechanical ventilation is also available to aid breathing if necessary. A drug called ribavirin can be given. This antiviral medicine interferes with the synthesis of viral mRNA, which prevents the RSV from replicating and further worsening the symptoms. This is the conclusion of our presentation on RSV, and the following is a list of the references that we used for information and pictures.